Insulin resistance and polycystic ovary syndrome, PCOS, are separate but often interrelated health conditions that affect a significant number of individuals worldwide. Insulin resistance, a precursor to type 2 diabetes, occurs when cells in the body don't respond effectively to insulin, leading to elevated blood sugar levels. While PCOS is a hormonal disorder common among women of reproductive age, characterized by irregular menstrual cycles, excess androgen levels, and polycystic ovaries. Individuals with insulin resistance may experience symptoms like fatigue, hunger after meals, difficulty concentrating, and weight gain, especially around the abdomen, whereas women with PCOS can suffer from acne, hair growth in typically male pattern areas, thinning hair on the scalp, and difficulties with fertility. Treatment for both conditions often involves lifestyle modifications such as diet and exercise, and may also include medications like metformin for insulin resistance and hormonal contraceptives for PCOS. Risk factors for developing either condition include a family history of similar issues, obesity, and sedentary lifestyle, with the potential for insulin resistance to exacerbate PCOS symptoms. Here's a detailed breakdown of the nuanced aspects of both diseases, shedding light on their complex interplay and impact on health. Metabolic regulation, insulin sensitivity versus hormonal imbalances. Insulin resistance, a condition where cells in the body become less sensitive to the insulin hormone, is a key player in metabolic disorders, including type 2 diabetes, and often goes hand in hand with PCOS, polycystic ovary syndrome. With PCOS, a woman's ovaries produce an excess amount of androgens, which are typically considered male hormones. This hormonal imbalance frequently dovetails with insulin resistance due to the interplay between high insulin levels and androgen production. It can create a vicious cycle. Insulin resistance exacerbates hormonal imbalances, thereby worsening PCOS symptoms, which in turn can increase the risk of developing further insulin resistance, contributing to a spectrum of metabolic issues. These linked conditions emphasize the need for a comprehensive approach in diagnosis and treatment, focusing on both insulin sensitization and hormonal regulation. Primary manifestations: glucose metabolism versus reproductive system. Insulin resistance is a pivotal factor in the pathophysiology of PCOS, polycystic ovary syndrome. While PCOS primarily manifests in the reproductive system with symptoms like irregular menstrual cycles, hirsutism, and infertility, insulin resistance reflects in disrupted glucose metabolism, increasing the risk of developing type 2 diabetes. The two conditions are intertwined, as insulin resistance can exacerbate PCOS symptoms by elevating androgen levels, leading to more pronounced reproductive manifestations. Conversely, the hormonal imbalances characteristic of PCOS can contribute to the worsening of insulin sensitivity. Thus, managing insulin resistance through lifestyle changes and medications can be key in mitigating the primary effects of PCOS on the reproductive system. Common comorbidities: type 2 diabetes mellitus versus infertility. Insulin resistance is a pivotal factor linking polycystic ovary syndrome, PCOS, and type 2 diabetes mellitus. It acts as a pathophysiological bridge between these conditions due to the body's impaired response to insulin, causing elevated blood sugar levels. While both PCOS and type 2 diabetes share this metabolic disruption, they diverge significantly in their clinical manifestations. PCOS often leads to infertility as a primary concern, primarily due to anovulation. Conversely, while type 2 diabetes doesn't directly cause infertility, its long-term complications can affect multiple organ systems, potentially impacting reproductive health indirectly. When diagnosing, it's crucial to consider these comorbid conditions, as their concurrent management can improve both metabolic and reproductive outcomes. Primary manifestations: glucose metabolism versus reproductive system. Insulin resistance is a metabolic condition often associated with type 2 diabetes, where the body's cells do not respond effectively to insulin. This inefficiency leads to elevated blood glucose levels and can predispose individuals to various health issues. Conversely, polycystic ovary syndrome, PCOS, is an endocrine disorder primarily affecting the reproductive system of women, characterized by irregular menstrual cycles, cysts on the ovaries, and elevated androgen levels. Both conditions share insulin resistance as a common feature, albeit manifesting differently. In PCOS, insulin resistance contributes to hormonal imbalances and reproductive dysfunction, making its management complex as it intertwines strategies to regulate both glucose metabolism and reproductive health. Typical presentation: age, any age, versus reproductive years. Insulin resistance is a widespread condition that can occur at any age, impacting the body's ability to efficiently use insulin, leading to elevated blood sugar levels. Its universality contrasts with polycystic ovary syndrome, PCOS, which specifically targets individuals in their reproductive years. PCOS is characterized by hormonal imbalances that can result in irregular menstrual cycles, infertility, and other metabolic complications, often interlinked with insulin resistance. While insulin resistance itself presents as a metabolic issue with broad implications, including the risk of developing type 2 diabetes, PCOS embodies a more specialized disorder where reproductive and endocrine systems intertwine, manifesting exclusively within a distinct life stage.